Good evening. My name is Alan Unell, and this series of videos is Healthcare Reform Advocacy, where we identify problems in the healthcare system and then take action that will make the system work better for all of us. I was shocked to learn recently that there are vaccines that can have a major impact on worldwide health, can save millions of lives, but are not readily made available. Before I go too far, let me point out that in the description below, we will publish a link to the Healthcare Advocacy Newsletter that contains the script for today's video. And all of the links that I mentioned will be in there. Okay, so let's continue. ProPublica recently detailed their investigation into just such a cruel behavior. In it, they describe how medical researchers use techniques discovered by the U.S. Army and the Veterans Administration when they were busy seeking to protect people from malaria. Now, vaccines are not new. During the Revolutionary War in the 1770s, George Washington had his soldiers vaccinated against smallpox using the cowpox virus. It was discovered a century ago that certain additives or adjuvants could be added to vaccines to help them teach the immune system and to make the vaccines far more effective. Now, the story that I'm referring to in ProPublica is about how one drug company, GlaxoSmithKline, owned the rights to a key vaccine adjuvant. It was key to a tuberculosis vaccine that GSK had already run through phase 2 trials and found to be very effective. Well, it turns out that 5 years passed from the end of that phase 2 trial, and they chose not to move to the phase 3 trial to get testing approval, to complete testing and get approval to release the vaccine. Now, it's important because tuberculosis kills about 1.6 million people every year. So let's recap. They found a vaccine that worked. They did not take it through phase 3 trials. 1.6 million people dying every year. They used this adjuvant successfully in their shingles vaccine, Shingrix, and they used it in their brand new RSV vaccine. And between those two, they will make billions of dollars in profit. But they did not move forward on the TB vaccine, which is where they found this adjuvant so successful. Now, in 2016, at an investor meeting, GSK, GlaxoSmithKline, told shareholders that they don't do public works just because they're noble or philanthropic. They do them so that they learn what works so that they can make a fortune, like with the shingles vaccine and the RSV vaccine. Well, the Gates Foundation managed to shame them into selling the rights to use the adjuvant that they had discovered for the TB vaccine and to move it forward. They bought the rights for $10 million. The foundation then took responsibility to get the vaccine ready for phase 3 trials next year. It is the only vaccine that meets a set of characteristics that the World Health Organization believes are necessary for a viable TB vaccine. In the time between the phase 2 testing and when phase 3 begins next year, 9 million people will have died of TB because they needed to make billions. Okay, let's talk about another subject, abortion resources. I just read that there's a new safe private abortion information source for all states, and it is available through a new chatbot. People in need of abortion information in all 50 states now have a new tool to help them. It's called Charley, the chatbot. It was co-founded by former Planned Parenthood President Cecile Richards and the former head of Planned Parenthood's digital department, Tom Subak, in partnership with, these will all be in the links in the description, ineedna.com, Plan C, and the Miscarriage and Abortion Hotline. Charley provides accurate, accessible, and confidential abortion information to people who need it. There's going to be a link to show you how to use it. It's available in English and Spanish. It can also help people that are in restrictive states to get travel information, approve FDA pills by mail, and find low-cost or sometimes free ways to buy the needed pills. Users need only submit their zip code and their last period date. Conversations are deleted hourly. Data is never shared or tracked, and using private or incognito browsers can help add an extra layer of security when needed. Okay, let me stop right there and say, if you're in a state where abortion is illegal or banned or restricted, use an incognito browser. And the reason is that if somebody suspected that you were searching for abortion information, they can actually subpoena your internet records. Charley will delete records on their site, but on your side, those records would still exist. So an incognito browser, please. Okay, no sense letting the bad guys get your data. You can learn more about the chatbot Charley's information for people in need of abortions at a link that will be in the newsletter. Okay, medical strike. Well, last week, nurses, pharmacists, and other healthcare workers at the nonprofit Kaiser Permanente facilities in California, Oregon, and Washington, and Colorado struck. There were 75,000 people went out, and one of their key demands was for the nursing staffing levels to be reduced to safe levels for nurses. The way they did this is they struck for 3 days in a row, they took a break, and then if the strike is not resolved, then in early November, they'll pick another few days and strike again. They're doing it this way because they actually have a conscience and they're not there to punish patients. Keep that in mind. Now, Kaiser admits that they have a nursing problem, a shortage, because they've got recs out for 10,000 nurses. That's not a small number. There is a critical shortage of working nurses in the United States, and these were statistics I learned recently. I was shocked. About a third of nurses plan to leave the profession, period, because they are so overwhelmed, largely due to the staffing problem, and there are wage issues. Now, this statistic I found particularly disturbing. Half of nurses that graduate leave within 2 years of graduation and don't go back to the profession. Well, it's a sad situation. More nursing schools will help get more people into the pipeline, but safe staffing levels and fair wages are needed to keep them there. According to National Nurses United, there are about 1 million trained nurses in the United States that are not working. Well, we've written about patient overload and demanding physical conditions in the Healthcare Advocacy Newsletter and workplace violence that they have to face. It is just horrible. Okay, but there's an action you can take that'll make some of this better. Senate Bill 2840, the Bipartisan Primary Healthcare Workforce Act, will help train about another 60,000 nurses. House Resolution 2530 and Senate Bill 1113, the Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act, will help with some of the issues that nurses face. Let's let our members of Congress and our senators know that we want them to take action. In the Healthcare Advocacy Newsletter, you will find a link to their either phone or email, or I'll give you a quick way that you can send them an email on your cell phone. On your cell phone, send a text to 50409 and type in sign, SIGN, POPDQO. And you'll be sending them an email to tell them you want them to pass those pieces of legislation. Okay, that's what I have for today. Like, share, subscribe, put comments in the comment field, or you can send me comments personally at healthcareadvocacy1@gmail.com. Have a good evening.